thank you for the nice introduction, and thank you to the organizers for giving me the opportunity to present some of our data from Sweden on insular brain metabolites and their association with somatic symptom burden and cognitive coping skills in irritable bowel syndrome. Well, over the last 2 days, we've heard a lot about IBS as an exemplary disorder of brain-gut interaction. We've heard a lot about alterations in peripheral measures, including microbiota, but there's also substantial evidence that there are profound changes in the central nervous system. Besides the crucial relevance of centrally mediated factors, such as anxiety, depression, altered stress responses, are increasingly acknowledged in IBS pathophysiology, which is well in line with the previously mentioned central alterations, especially in brain function, affecting neural circuits involved in salience, in emotional arousal, but also in cognitive regulatory processes, which are also involved in emotional and cognitive pain processing. Within these circuits, the anterior insula appears to play a fundamental role. It is considered a keynote involved in interoceptive awareness. Specifically, the anterior insula seems to integrate interoceptive signals with emotional and cognitive input to form a representation of subjective interoceptive feelings. And in fact, aberrant anterior insular function is one of the most consistent findings from brain imaging studies in irritable bowel syndrome, as well as in other functional gastrointestinal disorders such as functional dyspepsia. These changes were found during resting conditions in terms of negative functional connectivity, mainly with regions of the default mode network, as well as in terms of increased responses in IBS patients during the anticipation of visceral pain and during the perception of visceral stimuli. It has recently been proposed that altered neurotransmission may be a putative biochemical mechanism underlying these alterations in brain function. Specifically, changes in glutamate as the main excitatory and GABA as the main inhibitory neurotransmitter in the human brain have sparked interest in their role in alterations in brain function in chronic pain conditions, including visceral pain. And interestingly, altered metabolite concentrations of glutamate, and more recently, due to methodological advances, also GABA have been reported in several chronic pain conditions, including fibromyalgia and migraine, and one single study also in irritable bowel syndrome, and also across various brain sites, including thalamus, posterior cingulate cortex, posterior insula, and prefrontal cortex. Interestingly, these metabolite changes were also associated with both disease-related factors, such as experimental pain threshold and clinical pain measures, but also with psychological measures, such as anxiety and catastrophizing in patients. However, while anterior insula appears to play a key role in the processing of interoceptive visceral signaling and its cognitive regulation, anterior insular metabolic changes in IBS remain to be elucidated. We therefore aim to test whether GABAergic inhibitory and or excitatory glutamatergic neurotransmission would be altered in IBS patients, and we were further interested in whether these changes in metabolite concentrations would be related to either disease-related or psychological symptoms. To do so, in 35 IBS patients, female IBS patients, and 20 age-matched healthy women, we conducted quantitative magnetic resonance spectroscopy of the anterior insula bilaterally using a 3 Tesla Philips Insular scanner with a 32-channel head coil and a voxel size of 4.5 by 2 by 3 centimeters. We implemented a megapress sequence that methodologically allows the detection of both GLX as a combined measure of glutamate and its precursor glutamine, as well as GABA plus, representing GABA plus a macromolecule signal. For correlational analyses and, of course, for the characterization of the population, we used a questionnaire battery assessing IBS symptom severity somatic symptom burden, pain intensity and interference, but also psychological measures, especially GI-specific anxiety, general anxiety and depression, and cognitive and behavioral pain coping strategies. Now, not surprisingly, compared to healthy controls, patients showed increased levels of symptom severity, of symptom burden, of GI-specific anxiety, higher pain scores, and higher anxiety and depression. Now, looking at group differences in metabolite concentrations, we found reduced GLX levels in anterior insula in IBS patients in both hemispheres, with more pronounced changes for the right side as depicted here. GABA levels on the other side were not altered in either hemisphere in IBS patients. Now, correlational analyses with disease-related and psychometric measures in the full sample revealed a pattern of negative associations of bilateral anterior insula with somatic symptom burden, IBS symptom severity, GI-specific anxiety, depression, and also the tendency to use catastrophizing when faced with pain experiences. Interestingly, our findings also suggested effects in a hemisphere-specific way, with only left anterior insula being distinctly positively related to adaptive pain coping strategies, such as diverting attention and increasing activity, whereas only right anterior insula levels were negatively correlated with pain-related measures, specifically pain intensity and pain interference. To further elucidate these associations, we looked at correlations in IBS only, and consistent with findings in the full sample, we found the strongest associations with somatic symptom burden, with lower GLX levels being associated with higher self-reported symptom burden in patients. And interestingly, our findings in IBS only confirmed the observations in the full sample that only left anterior insula, but not the right side, were associated with adaptive pain coping strategies also in patients. So together, this is, to the best of our knowledge, the first study reporting anterior insula or investigating anterior insula metabolic changes in IBS patients, and we observed reduced GLX concentrations in IBS, whereas GABA levels appeared unaltered. These reduced GLX concentrations were associated with higher somatic symptom burden and less use of adaptive coping strategies when coping with pain. Furthermore, our findings suggest or give first evidence of a functional lateralization on a biochemical level, indicating that the left anterior insula might be distinctly involved in cognitive modulatory processes. And finally, to conclude, disturbed anterior insula excitatory neurotransmission may play a key role in both pain processing and its cognitive regulation in IBS. And I would like to thank my co-authors, some of whom are joining me today in the audience, and thank the funding agencies without whom this work wouldn't be possible to conduct, and of course, thank you for your attention.